lessons. If you learn things along the way, please let us know. We want to make this a good experience for everybody. Today, in the telehealth webinar, we're going to be discussing a few different points. One will be reviewing the workflow for telehealth. We also will be discussing Microsoft Teams for video conferencing. Let me actually just stop right there and tell you a little bit about Microsoft Teams. We chose to use Microsoft Teams as our video conferencing platform because it was a ready-made solution that we could push out to a large number of people in a very quick manner. It's also HIPAA compliant. You're going to hear a lot about using a variety of different modalities for video conferencing. And during this emergency period, those modalities can be utilized. But what we wanted to create was a more long-term solution. So Microsoft Teams allows for synchronous video conferencing and allows us to use this platform after this COVID emergency is over. So that was the rationale. The other piece of this is that our entire IT department uses Microsoft Teams and is very well aware of how to use the platform, how to problem solve for you. So again, we had a ready-made solution in the support feature of our Microsoft Teams and our video conferencing component. So that's some of the rationale why we chose Microsoft Teams. In this webinar, we're also going to be discussing telephone virtual visits. We're going to be reviewing our Telehealth Note that was just newly created. We're going to discuss how to schedule a telehealth visit. We're going to discuss billing codes for telehealth. And I'm even going to tell you what you can do today to start your telehealth practice. Our telehealth platform will include two means of communicating with your patient: video conferencing with Microsoft Teams and telephonic virtual visits. In order to understand a little bit about Teams, Teams is a software solution that's used in a variety of different ways. It's used to chat, it's used for meetings, it's used for video conferencing. It actually syncs with your Outlook calendar. Everybody that has a CMHS email address will have this Microsoft Teams pushed to them. As you see here in this little icon, this Microsoft Teams icon, that's how you launch your video conferencing. Everybody should have that. If you don't have it, you can call the help desk at 5090, and they can help walk you through getting that onto your hospital-issued computer. If you would like to download Microsoft Teams to another device, such as a tablet or a phone or another desktop, you actually have to go through setting up multi-factor authentication. It seems like it's a little confusing, but it's not. It's with the Microsoft Teams, we have an audio clip, and I'm not sure what it is. I'm going to pause right there. Okay. Some people are able. All right, everyone, we're just getting the information that our audio capacity has been reached. I guess Christine's a lot more popular than we realized. And I do apologize, that is a cap on our account, and that's nothing that we can fix at this time. Again, we are recording this, and hopefully your colleagues who are not on will be able to download the recording later today. I will ask Christine, I'm not clear if it's recording the video, so if you could just reference what slide you're on while you're talking and say you should see on your screen this. I think that will be helpful reference for those people who are listening to the audio later as well. We'll go ahead and continue. Alrighty, great. So right now we're actually on slide number 5, and what I was describing was that most of you should have Microsoft Teams on your hospital-issued laptop. It should be there already. It was pushed. It's been pushed in the last day or so to everybody's laptops. So that's current state. If you'd like to set up your tablet or your phone or another desktop computer, you will have to go through what's called a multi-factor authentication process. And that seems like it's a little confusing, but it's actually not. And we've sent out a document that can help you through that process. And really, all you need to do is do step one. Just click the link in step one, and you'll be able to go through, put your hospital email address in there, and it very quickly takes you through this multi-factor authentication process. And then you'll be able to enable any of your other devices, like a tablet or a phone, for Microsoft Teams. And the reason why that's important is that you want it to sync to your hospital Outlook, because when you let it sync to your hospital Outlook, you then it'll be seamless across the platform. So I'm going to move to slide 6. We also, in the documents that I've sent you, have a document that can walk you through some training videos. There's a quick reference guide. So again, you will have all these tools at your disposal if you just print them out from the documents that I sent you. The help desk is also available to help get you set up at 5090. So the next 3 slides are very busy slides. They're meant to be busy because part of this video webinar is didactic. So I wanted to first take you through a telephone virtual visit appointment. So what we've done is in all the processes that we've created, we have used Medicare guidelines. And the reason why we've done that is because right now, sort of the messaging that the administration has put forth is sort of like anybody can do anything. And that's really not the way it is. We still have to follow Medicare guidelines. So I'd like to just briefly tell you what a telephone virtual visit is. A telephone virtual visit is a 5 to 10 minute check-in visit with the patient. You cannot have seen the patient for a related E&M service within the previous 7 days, and it can't lead to any appointment within the next 24 hours. So a good example of that would be if you saw a patient if you saw a patient in the office a week and a half ago, you ordered lab work, they're hyperlipidemic, you would like to talk to them about their starting statin or adjusting their medication, you could call them on day 8 and have a telephonic virtual visit with them. You could document the virtual visit in the note type that I'm going to show you, and then you could bill it out. I'm going to pause for one moment. I don't know if our presentation is showing or not right now.
Yeah, I got it. Hold on just one moment.
So let me just talk a little bit more actually about the telephonic virtual visit. We created a note type called a TD10 note type. And all of these virtual visits or video conferencing visits will still have to follow the same process as when you're seeing a patient in the office. So the patient will still need to be arrived. A note will still need to be opened. And again, you need to have that sequencing so that you can appropriately bill the visit out. And if you just decide that you want to go and call a bunch of patients and not open the notes in that sequenced way, it's going to make it very difficult for billing. And it makes it very difficult on the back end to link those notes. So what we would recommend you do is, again, if you'd like to talk to a patient telephonically, that you put them on your schedule, you create the appointment type of TD10, that you arrive the patient, you open the Telehealth Note, and that you then are able to document in that note and bill it out accordingly. We're going to pause for one moment because I think that we're having some video issues.
Can you go and... reload the presentation. Bear with us for just 1 second.
All right. I'm glad I brought my technical guru today. So again, with the telephone virtual visit, that's how you would go through it. Any telephone virtual visit, you will need to document the minutes you did during the visit as well in the note. But we'll discuss that a little further down the line when I discuss the note type. It's clicked off again.
All right, everyone. Sorry about this. I am going to reload this now.
All righty. So let's discuss. We're on slide number 8. We're going to discuss synchronous video conferencing with Microsoft Teams. We are recommending that you choose established patients that wish to engage in a telehealth appointment. This will be approved by the clinician prior to scheduling the appointment. What we're recommending is that the provider looks at their schedule and tells their MA which patients might be appropriate for this type of visit. We also are recommending that the patient have a smartphone to video conference with you. They can do a desktop option, but the problem is that the desktop, a lot of patients don't know if they have the video capacity on their desktop. If they do, then that would be an option to them. But in our pilot, we really found that if a patient is talking to you on their cell phone, it's a very intuitive process, and it's probably going to be the most seamless at this point. You'll schedule a patient for a telehealth appointment in the Allscripts PM. You'll use a VCE, which is Video Conferencing Encounter. We've created a new appointment type for that. You'll check insurance eligibility just like you would normally do on any patient, and then schedule a patient for the telehealth visit in Teams. We will walk through how that happens with your staff so that, again, we can make certain that we are able to sync two processes. One is scheduling the patient in the PM, and the second is scheduling patient in Microsoft Teams. Move to the next slide, which is slide number 9.
So, Christine, I'll go ahead and forward the slides for you. I think that'll be a little smoother.
Terrific. So, as far as how your patient will get the invite, we will send a link via Well. We'll invite the patient to download the Teams app, and we'll outline basic instructions for them. The patient then will need to be ready for their video conferencing appointment 15 minutes prior. The patient will wait in a virtual waiting room. Your MA will then arrive the patient. They'll confirm the patient demographic data, and they'll open the Telehealth Note type and record a chief complaint. Next slide. This is what it'll look like on the clinician side. So when you open up your Microsoft Teams, you'll go to your calendar section, and you'll actually see your patients listed by their appointment, time, and date. When the patient is ready to be seen, you'll actually see a little join icon that will be to the right of the patient's name. All you'll need to do to launch your video conferencing appointment is push the join button. Next one. This is a busy slide, but this is actually what we will be sending out via well text to your patients. We'll be well texting them the Microsoft link. They will then install the app onto their phone, and they will designate themselves as a guest, and they will actually be ready to go for you. Next slide. And this is what it'll look like. It will be as simple as a join now. You'll push on join now and you'll be able to video conference with your patient. Next slide. So I wanted to talk a little bit about the newly created Telehealth Note. Next slide. The Telehealth Note, you'll be able to find it right where you find your other notes. You'll put in your specialty. This note type has been enabled for all specialties. You'll put in your visit type. If you do the drop down, you'll see it just right under established office visit, and you'll be able to choose that note type. Next slide. When you open up the Telehealth Note, it'll look different than your normal notes, and I'd like to point out some important features of the Telehealth Note. On the left-hand side, you'll see under HPI, it says Free Text HPI Telehealth. You'll click on that. Heading, and it'll open up this note box. There's two pieces of the note that's very important, and we created this that it is aligned with Medicare. You'll see that pain consent for the telehealth encounter from the patient. Again, Medicare wants to make certain that the patient understands that this is a telehealth encounter. If you check that box, it'll automatically put verbiage into your note to this effect. We also put a box in there that the patient initiated this telehealth encounter. You'll read all the time that these telehealth encounters need to be patient initiated. Medicare gave us further clarification on that on May 5th by basically saying you may tell the patient that we have telehealth available to them, and they may then opt to do their appointment via a telehealth modality. And by doing that, that counts as the patient initiating the telehealth encounter. So it's a nuanced process, but again, those are two requirements for Medicare. Next slide. You'll also see that we built into the physical exam portion physical exams features that are visual features only. So again, under pulmonary, you'll see assessment of respiratory effort, but you won't have any other physical exam findings for pulmonary. We have a skin exam, we have, again, psychiatric, and then we have a text box for anything that you might want to add. So this is the visit charge component. In the documents that I've sent you, you will have a one-sheet telehealth billing from Tracy. We were updating that as of 5 o'clock yesterday. It's the most recent information that we have to date, or I should even say to the hour. And what we've done here in the context of the note is try to put the most common telehealth visit codes there. Let me describe to you what a telehealth visit code is. For Medicare, PPO insurances, and Seaview, it is a regular E&M visit code. And it will actually follow all the rules of an E&M visit. Okay, so you have to have your problem, your review of systems, a pertinent physical, and pertinent plan. For the Medicare telephone notes, there's just one option. That's the G2012. It's a 5 to 10 minute virtual telephone visit. It's a very short visit. And again, that's the only thing available for Medicare patients. Gold Coast actually breaks it down differently. Gold Coast has 3 different tiers for each of the telephone visits and the video conferencing visits. You'll see the minutes that are delineated there. The one very important piece is that you make certain that you document minutes. And the way you can remember this is we put the minutes next to any visit where you need to document minutes. So it's not just a matter of pushing the button in the visit code area here. It's a matter of documenting it as well. All right. So what can you do today? Today, you can make certain that Teams is set up on your computer. Again, most of you have the icon on the computer when you open it today.
I have a couple of notes about that from one of our Allscripts trainers. That is Miriam. And Miriam comments that anyone who already set the multi-factor authentication for their email up done that? And Christine's saying no. Can you talk a little about that expectation?
Yeah, so what we did is, so historically that was true. If you were set up for multi-factor authentication, you would have that. But actually what we've done is Keith and his team have pushed that application to everybody's computer. Okay, so that's something that's been new. We've kind of we've lifted that barrier. Now, where the multi-factor authentication process comes in is if you want to set up Teams on your smartphone or your tablet, then you must do that additional layer of making certain that you have multi-factor authentication set up. Because again, a lot of times you might want to use your device as your video device and then be documenting in the EHR on your desktop or your laptop. And again, that'll be provider at the provider discretion. We've had 5 physicians that have been involved in our telehealth pilot. 2 physicians actually have really liked using their own cell phone as their video device, and 2 physicians have actually been really happy just having 2 panes open, one being their EHR and the other being their Teams application. They've liked having it both panes open on their laptop, so that worked for them. So again, this will be at your discretion, but you have full flexibility in that respect. But those are 2 things you can do today to get yourself set up. You also can look at your schedule for next week. Identify appropriate patients on your schedule that you want to schedule for telehealth. You can actually convert those appointments in the PM. You can convert them to telephone virtual visits or video conferencing encounters. And you'll actually then be getting set up for that next week. All right, so what will next week look like? So I already told you that you can do telephonic visits starting today. As long as you set the patient up with their TV10 appointments, you arrive the patient, you open up the note, you'll be able to call your patients and start creating revenue today. Okay. As far as your video conferencing piece, that will take some time to train your staff. We have 2 different things set up. We have a clinical team set up as well as an IT team set up. We have 7 analysts that will be available. We'll have two of our offices to every 1 analyst, and we'll also have clinical people on site to help train your staff to schedule the teleconferencing appointments. We will be having a webinar on Monday for MA staff and front office staff, again, to orient them to the process. It'll probably take a good week to get this up and going. But I have to tell you, in our pilot physicians, I did not meet personally with any of them. I was able to completely walk them through the process over the phone. We were completely able to support them over the phone. They all were able to sign into the application without a problem, and they all had positive experiences. So once we really figure out this, how to get the application over to the patient and how we understand how to arrive the patient virtually, the rest of it actually will go quite easily. But it's a matter of taking the time to train the staff correctly, and that will take probably this next week to get that up and going. That's probably all I have. I'm going to take questions at this time. If you'd like to chat with Lori, she will push the questions over to me.
So I do have a couple of questions right now, Christine, in the chat. And while we field those, if you have additional questions, you can submit by using the chat feature. You should have a little conversation bubble that says chat under it at the top towards the right. And you can go ahead and type your questions in there. If you would like to be unmuted, if we have some time towards the end, we will unmute a couple of people to ask verbal questions as well. Please let me know. The first question, Dr. Shane Shepard asks, I saw a number of patients telephonically this week. Can I retroactively change them to this specific note type, or what should I do?
So, yeah, Dr. Shepard, you definitely can. What I would recommend is that you convert them to the TV10 appointment type. You arrive them. You have your MA open the note, and then you document in that note, and then you bill it out accordingly, and you put the time you spent with the patient. So that's definitely something that you can do. I also just want to throw this out there. I almost hesitate to throw this out there, but I know that all of you have reading about FaceTiming your patients and Skyping your patients. And during this emergency time, that is a modality that can be exercised. But two things and two caveats to that. Number one, they're going to have your cell phone number, unless you get a burner phone and run your FaceTime that way. And number two, I don't know what that will look like after this emergency is over. I think that it was not a modality that could be used previous to this emergency. And if you just kind of give us this little time to get over the hump of figuring out how to schedule these patients and arrive them, I think that this Teams platform will work quite well.
Okay, we have a two-parter from Miriam. The first part is, are the note types specific to each specialty? I'm OBGYN. OBGYN doesn't need the EENT, the first part.
Mm-hmm. So that's a great question. This is a specialty agnostic solution. If you have something that's specialty specific, you can put it in the text box at the bottom. So this note type was put out to all specialties the same.
Okay, and part two. What about dealing with sensitive visual exams, private body parts, things like that?
Right. So I think at this point, these are for fairly straightforward appointments. And again, the recommendation is that the provider look at their schedule to see who would be appropriate for a telehealth appointment. Telehealth in a lot of arenas are used for, coughs and colds and rashes and, kind of primary care, fast track type of medicine. Again, we're trying to have it be a broader application, but I would use your clinician discretion to what you think that you can adequately assess in a telehealth environment.
Great. And this is Lori. I just want to add that we're working hard so that in the next couple of days we will probably pivot to an OBGYN clinic where there are not sick patients. And so we're hoping that for those patients who do need to come in, we can provide an appropriate and safe in-clinic experience as well. So more to come on that. Another question, do we need to document patient, this is from Dr. McCrary, do we need to document patient-initiated encounter for the G202 telephone 5 to 10 minute code?
Yes. So the language right now, and again, under this emergency order, they maybe won't be as excited about it, but I think it's a good practice habit to document that this was still a patient-initiated appointment. And again, like I said, the caveat is your office can reach out to the patient and let them know that telehealth is a modality that is that you are offering, and again, the patient can then accept that modality, and that can be deemed as patient-initiated.
Great. Question from Dr. Butler. Hi, Dr. Butler. She would like to know, how does the payment compare to current payment?
Right. That's a great question. So the E&M, currently during this emergency phase, and I really want to make that caveat, that during this emergency time, for Medicare and PPOs, it is being reimbursed at the same rate as an E&M visit. Okay? The telephone virtual visit is a much smaller reimbursement. It's on the order of $15 to $26. The reimbursement for Gold Coast, it's actually been changing. At this point, the telephone visits are, between $25 and $45. They may be reimbursing the video conferencing visits at the regular rate, but again, we're still looking for some direction on that. We have a call into Gold Coast, but it looks like at least during this emergency phase that you will get paid for synchronous video conferencing, very similar to what you would get paid for a regular E&M visit, office visit.
Okay, and more questions, and we might not get to all of them, but I'm going to go ahead and pick a couple here. Great question from Juan Ramirez. Will there be someone available to help the patient with technical support?
Yeah, so during our pilot phase, when we send the patients the links, so when we schedule the patient for the video conferencing appointment and we're talking to them on the phone, we're sending them the well link to the Teams app at the same time. So the patient gets it in real time. We are walking the patient through that process. We're having them load the Teams app as well as sign in as guests, and we are affirming video contact at that point. And so we get them set up when we're making the call. And then the nice piece is that the patient is told to arrive virtually 15 minutes before their appointment. We are able to see them in video context that they've arrived. We arrive them in the PM. The MA will be able to make certain again that video contact is made, and they will then enable the join button on the physician's team calendar, and the physician then just pushes the join, and boom, the video conferencing happens. But to get back to your question, that's where the training piece needs to come in for the staff. They really need to understand how to schedule this video conferencing appointment and then how to arrive the patient. So we're going to be working really hard probably the rest of today and Monday and we have the workflow completely hammered out. We just need to get the information to our users, and that'll happen today and Monday and throughout next week.
So a related question, is the link going to be available in Spanish for the Spanish-speaking patients? And I will tell you that we set it up, anything that we set up in will, but other thoughts on other languages?
Yeah, so we have, I'll have to look into that. You know, I'm just thinking, I don't know that the app is set up in Spanish, so I will look into that. That's a great question.
Yep, that's a great question. We have several more. Does the time in the encounter include only the face-to-face conversation with the patient and not the documentation time, from Dr. Butler?
Right. So it's the time you spend with the patient.
Great. Can we use FaceTime or Skype if we have to?
Yeah. So that's what I was alluding to before. During this, under this emergency order, you can definitely use Skype or FaceTime. And again, your patient is going to have your cell phone number unless you get a burner phone and want to run it through that. And again, I can't guarantee that will be a modality that will be supported after this emergency order. But while we're getting kind of all these pieces in place over the next week, yes, you can communicate with your patient that way. Let me just, again, you still have to go through all the pieces of making certain the patient's on your schedule, arriving the patient, and then doing your video conference and documenting it appropriately and billing it out. So, as long as you do those pieces, yes, you can use that modality.
So we have a couple of other questions, and they've come in from several different physicians wanting to know, can the physician do these visits from home, or do they need to be in a clinic setting?
Yeah, so right now they need to be in a clinic setting. We're looking at seeing if they can be done at home. But right now, with the best information we have, they need to be done in a clinic setting.
Great. And this is Lori. I just want to add to that. I did read over several of the Medicare documents, though my research is not quite as thorough as Christine and, for example, Tracy have done. But the intent of this is for the patients to be able to stay home. There was no mention at all of the providers having an alternate work site. That might change, but at this time, the intent of Medicare is for the patients who are frail or may have health issues for them to stay at home. Additionally, some of this workflow with, it needs to be in the PM, the patient arriving, and all of those things would make it logistically difficult at this time to roll this out with the physician also being remote. Again, we're open to working with you later down the line, but right now we're really working hard just to get this rolled out. Another technical question, did the patients need to have the app?
Yeah, so the patients definitely need to have the app. And again, that is a link that's sent to them via a well text. And so they'll load the app on, and again, then they'll sign on it as guest. And it's pretty plug and play. One of the hitch points seems to be the patient sharing their video screen. But again, we've even worked through that and can resolve that fairly efficiently.
So there's a question as well from a couple of different sources that they want to know if something has to be scheduled in the PM, a scheduled appointment. And I believe the answer is yes. That is how we keep track of and bill for our appointments. Also, it causes a lot of technical problems. So you will have to make an appointment. And do you want to talk a little bit about the possibilities on that process?
Yeah, so what we've been doing with our pilot physicians, they've been blocking like a 2-hour block where they'll see their telehealth appointments. And I would suggest that for you as well, where maybe you might want to see patients in the morning and then block 2 hours in the afternoon where you set up your schedule to talk to patients telephonically or via video conferencing. That seems to work well. You probably can go back and forth, but I think it would be a little bit more discombobulating. But again, after we get, after this process kind of gets ironed out, it might be an option for you where, you might want to do it like that, where you're seeing a patient and then somebody's arriving virtually and you could see them virtually. Again, the patient's basically just sitting there waiting for you to come on the line. So, having them wait for more than, 10 minutes or so would probably, they might leave. But as we move forward in this, I have a feeling everybody will kind of figure out a workflow that works for them. But right now we're suggesting that you pick a block of time.
Okay, great. We have several other questions, so we'll just keep on for a few minutes here. I think we're going to probably try to end this at the top of the hour, but we can squeeze a couple more in. If we don't get to your questions, we will try to put together an email with a couple of FAQs, and that way we can address the questions that way. There is a question, actually several questions, and I'll just kind of roll them into one, related to telephonic-only visits and what is allowed for telephone-only visits at this time. And I know that Gold Coast may be separate, and we've received some guidance on that. We may want to have a separate call just to talk about Gold Coast. But can you talk a little bit about video conferencing versus telephone only and what we know at this time?
Okay, well, again, if you want to get paid for an E&M visit, you must have synchronous, means bidirectional, means you can see the patient and they can see you via video if you want to get paid for an E&M visit. If you want to call them and talk to them on the phone, that would be telephone only. Now, some people say, well, the patient, doesn't want to do the video part. Well, then it's not a synchronous video visit. Let's just say the patient gets frustrated and the video piece isn't working. You can always convert it to a telephone visit. But again, it's not a video conferencing visit. It's then a telephone visit. And again, with the telephone visits for Medicare, there's specific verbiage around it that you can't have seen the patient in the last 7 days for the same problem, and it can't lead to an appointment in the office within the next 24 hours. So if a patient calls you and says, I have chest pain, and you talk them through it, and you end up sending them to the emergency department, that cannot be a telephonic virtual visit because it led to them seeking medical care within 24 hours. So again, the telephone visits are great for those more chronic patients that you're checking in on a blood pressure log or a weight or adjusting Lasix or doing a quick lab follow-up. That's the appropriate case for a telephone visit.
I think we will do a little bit more research on telephone only and consult with Gold Coast a little bit because they in particular have expressed an interest. And we can handle that. That will probably be a whole separate webinar. Yeah. So the other thing is it's a really good question or comment, and I don't know if we thought this through, and it's from Dr. Dunan. How will we manage sharing documents that are typically signed when the patient comes into clinic? And so, we may need a consent or something like that.
Right. So that's why we're suggesting that this is with established patients only, because then you don't have the problem of needing, a wet signature on documents. I think that there are codes for new patients for telehealth, but at this point, we just don't have enough information about that and are not set up to do that. So my suggestion would be that you use these appointments as follow-up appointments for established patients only.
Yep. Okay, great. We're just about out of time. I'm going to go ahead and collect all of the questions that we have received on the chat, and we're going to try to go ahead and distill a little Q&A out of that. I really thank you all. I thank you for your patience during the technical glitches that we had. Again, refer to the email of documents that we sent out. I believe Adam Basua has also been trying to send the presentation out for those who couldn't see it. And more information to come. Again, thanks so much to Christine, to Frank and Keith and IT, to Tracy and her team and everybody who's pulled this together. We will try to launch this as seamlessly as possible. We will have technical help. I know Miriam's chimed in a couple times also about sometimes you need to reboot your computer and things like that, and that's why we'll have technical help. So we're hoping that rather than inundating the help desk with one-off questions, that you'll be connected with a team that will be able to help you and talk you through this. Again, more information to come on this, and I really thank everyone for visiting. We will try to send out the recording as soon as possible, and as well the FAQs.
All right. Thank you so much.
This concludes our webinar.
So a patient